Welcome back, and we are glad that you have been able to rejoin us. We go into the final segment of our show this morning, Kevin.
Yeah.
And we are going to be discussing a Pap Smear campaign that is being launched by the Belize Cancer Society. That being said, we have with us this morning Senior Administrator of the Cancer Society, Ms. Heather Reneau. Good morning.
Good morning. Thank you.
And we also have a volunteer from the
SUNY, New York.
SUNY, New York, right?
That's the acronym.
That's the acronym, exactly.
Rosario.
We have Rosario Romero. Good morning, Rosario.
Good morning.
Let's begin by discussing the campaign and what you intend to achieve having embarked upon this initiative.
Okay, well, this is an ongoing campaign at the Cancer Society. We're absolutely proud. This has been the 4th consecutive grant that we have secured for cervical cancer prevention. And it comes through the kind courtesy of the Healthy Caribbean Coalition, which is a regional organization that has band together to combat NCDs. And they got this funding from the Australian Direct Aid in Australia. So you see how far this money comes from. Now,
We'll take it.
Yeah, we'll take it, yes we will. Now, this funding is specifically important to us as cervical cancer is one of the leading causes of death for women in Belize. So with this grant, we're able to educate our women. We're able to screen them for free. Because you know Pap smear in the private sector, you go for a breast checkup, Pap smear checkup. It's $100+. Most women don't have that money just to spend on, you'd say, yes, it's your health, it's your wealth. But when you think in terms of economics and you have a family to support, you have your school fees to pay, you have your children to take care of, you have a dog, the dog food is expensive as well. You seem to forget ourselves as women. You know, we place ourselves on a back burner, and working very closely with the Ministry of Health and other stakeholders, we have recognized and identified that cervical cancer is one of the leading causes of death for women. We see it every day at the Cancer Society. And it pains us when a woman walks in with late-stage cervical cancer. And cervical cancer is one of the treatable and curable cancers. You can completely cure it, but you have to do your screening tests. From the time you become sexually active, you need to take your Pap test. You need to do your yearly checkup. We have to limit the amount of liquor we're drinking, the amount of smoking we're doing, the sexual activities in our lifestyle, because all of these things plays an important factor in our life.
You spoke about it being the leading cause. I'm curious about the numbers. What do the numbers look like statistically?
Well, statistically, from the Ministry of Health, unfortunately, we don't have a cancer registry in country at this time. But we're working very closely with the National Health Insurance. Dr. Perez, he's the lead charge on this. The Ministry of Health, we're bringing together stakeholders. So 2018 will be a year that you see a lot of moving and shaking with the Cancer Society and the ministry and the government, because we have recognized that we need to be tracking these numbers. It's not enough to just say, oh, it rose by 30% or 40%. You know, we need to see exact numbers. What are the age groups of our women dying? What are the stages they're presenting? You know, what are the signs? Because everybody's symptoms is different. Just as in breast cancer, somebody might say, oh, I had a lump in the breast, I had a discharge, I had an ill feeling. Some people won't even have a piece of pain. They won't even have anything. No signs, just a little bit of discomfort. Or, you know, sometimes maybe the breast might feel heavier or you feel a little bit off. And that might be your warning sign right there.
You identified a lot of lifestyle contributors.
Yes.
Before we started, you were explaining to us a bit of why this is so important and the way it works. Could you go back over that for me? Okay,
well, in terms of cancer, especially cervical cancer. Right? We have what we call contributing factors, and it plays a part in not only cancer, but diabetes, in cardiovascular disease, high blood pressure, and it's a cultural thing. We Belize people, the type of foods we eat starch and starch and starch. I'm guilty of it sometimes, but we have to change the way that we have lived. We have to change our lifestyles. I know sometimes in our culture, it's good for the man have to five or six ladies, and the woman might change their spouses.
That's nature, that's not...
That's not nature. That's nurture. You nurture those behaviors. That is not nature. And yes, it's fun. Yes, maybe it gives you some type of thrill, but you have to look at the statistics, because yes, women are the one that get cervical cancer, but the men carry the HPV virus. You guys carry it and you give it to us. And then when a woman is not being screened, she has this infection. This infection doesn't grow overnight. It takes 5 to 10 years. So imagine that you're having that, and some women literally don't go to the doctor until they smell a discharge. or if it smells funny, or if it has a funny color. And sometimes even then they won't go because they're embarrassed. You know, sometimes you might be a very good woman and somebody, you go to the doctor and say, cervical cancer in me bad. That's a connotation that we have in our society. You know, we have that stigmatism, that discrimination. And it is no one's fault but our own. We have to take charge, men and women, right? We are so proud. We have worked with the Ministry of Education that we've been able to implement the HPV vaccine in the school. There's still a lot of education to go in that area, so people understand the importance of this vaccine. You know, there are a lot of myths out there. There's a lot of editorials telling you that the kids could have this side effect and that side effect, but read up, learn for yourself. Don't listen to what people have to say. You get the facts, and you ensure that you prevent your child from having cervical cancer, and you secure a future for them. Because yes, we know the men are the head of the home, but a lot of time it's the woman that have to take the load. We're the one that carries the load. We take care of the kids, we take care of everybody.
And they have a lot to do. How regularly should a female do a pap smear?
They should at least be screened once a year.
Once a year.
So from the time they become sexually active, we say once a year. We know the laws have changed and all that, and we would push for screening 18 plus, but you know, things have changed and we have to address these issues as well. These are things that we don't want to speak about, but our culture is changing. Young girls are getting pregnant at a younger age. They're having sexual activities at a regular age, and it's not normal sexual activity.
It's Facebook and the music they're listening to.
Not only that, it's the experiences that they're having.
I want to get Rosario in on this conversation. In terms of your role as a volunteer in this process, what are we looking at?
Well, I just do a lot of trying to campaign and get a lot of information out there, brochures, things that people can easily just open up and read and get the facts. Because a lot of the times the facts are hidden, or you, like Ms. Reneau was saying, you hear it trickle down from a friend or a friend, and that's the type of information that people are getting. But if you sit and read a pamphlet and really understand the information, understand that it really is like silent, and understand that it could be preventable, I think, you know, it'll help people.
You seem fairly young, take that as a compliment. But this is something you were speaking to the youth component.
Yes.
How do you make this something that is relevant to young people? And how do you get them to come in and participate? What is the target in terms of this campaign? Are you looking for older persons, younger persons?
Well, the target for this campaign is younger persons. Like we brought in Rosario, she's all the way from New York. So she's a university student, and this is a part of her internship requirements.
Wow.
So we
she
also, yeah. We'll just see when that evaluation comes. We have to say a big thank you to the University of Belize, the Belize High School, SJC. We have a lot of volunteers that come through the Cancer Society for the year, especially in these campaigns. We want to empower the youth. We want to show them that you need to take charge of your health. You're the advocates. Yes, we're here to educate you, but you can show us what you need. Tell us how to get to you. Because maybe the way I'm delivering the information to you might be very receptive. But to somebody 16, 15 years old, you have to change up the techniques a bit. You have to empower them to pass on that information to their friends, to their peers. So we have incorporated a lot of ways, like Rosario is telling me she's working on some pamphlets and brochures that are youth friendly. We also have our social media platforms that we communicate a lot with our young people. We go to the schools, we have private sessions with them, we have internship programs, we have their volunteer programs. Like, you know, a lot of schools have to do community service. And we have built a program in the Cancer Society that the youths come and they build on top of that bank. So sometimes they get project tasks with different type of cancers. You give us your view on that. And sometimes I'm telling you, when these kids come with these presentations, you will be amazed.
Wow.
Most definitely, their thought process and the way they think. It's totally different.
So will this campaign be moving around? Will you actually be going into UB?
This campaign has
Is
been
it possible,
going on.
even possible?
Yes, this campaign has been going on since last year.
CCC?
C4PI. So it's a component that has been doing countrywide. So we have campaigns going on in Punta Gorda, we have with Dangriga, as we have very robust cancer societies. The Dangriga crowd, these ladies push, they go in all Bella Vista, they go in Criquesaco, all these little villages, and you would be amazed at the cultural differences between the Mayan culture and our Belizean culture and the Mestizo culture. It's totally different. But we have realized that everybody needs this support. The Dangriga crowd, Miss Lisa Cheng, Miss Sharon, they are actually amazing. They get out with the awareness and their education. They have a very strong component of education. We have the Kaya, we also have our Belmopan branch. So look out, we'll be having continued educational campaigns in all branches. Mr. Neil just did a wonderful talk in Belmopan with the National Heritage Library, which is very informational. So look forward, 4th of February is our World Cancer Day. That is celebrated internationally. So these campaigns will continue. The Belize City branch hosts the free screening. I repeat, free. You don't have to pay for anything.
Because we love free.
You don't have to pay for anything. You get your pap smear, your breast check, your blood and sugar, your height and your weight. So you come in this Friday, this Saturday, and you get all those services.
Where?
Absolutely free. Right at the Belize Cancer Society headquarters.
At what time?
2625 Mercy Lane from 9 o'clock until 4 o'clock.
Could you walk us a little through what the process is like? If I'm a young lady out there watching this and say, I probably might go, but I have two issues. How private is it, one, and how intrusive is it? They take out blood, what they want to do, you know?
Well, at the Cancer Society, we have found that that has been one of the barriers to persons accessing Pap smear services in the public sector, because we have Pap smears free at all polyclinics. You know, I don't think people know that. Any woman that wants a Pap smear can go to Cleopatra White, can go to Matron Roberts, can go to any one of these polyclinics, and you can get your Pap smear. You can get VIA services, you can get cryo. These doctors are well trained. But you know, in our culture, again, we have an old girl, that one might know you. You don't want to go there. At the Cancer Society, we operate on 100% strict confidentiality. When you come in, you're educated, you go into a private room, you're screened, and unlike what people say, the screening is not invasive. It's a minor discomfort. Some people say, oh, they scrape you. No, they don't take out any blood, they don't take out any scrapings, no. It's just a small little thing like a Q-tip, and it just collects a small swab, which we call
and you're talking from personal experience?
Yes, I'm talking from personal experience.
Credible.
Yes, credible. Credible sources. Right? And before that woman even receives that procedure, she's educated about it. She's explained step by step what it is. She's shown the materials so that she can become comfortable. Because remember, as a woman, you know, just sitting down and having somebody invade your privacy, worse if you don't know that person, it's a bit uncomfortable. But we make it as comfortable as possible. We have some women scared to go in, and they come back out smiling. They say, that man, I can't believe that's what I was so afraid to do.
That's what the education process does.
Exactly.
How long does it take?
It takes maybe 10 to 15 minutes, very quickly. And you get your results within 2 weeks. Your number is there at the Cancer Society, comes in a sealed envelope. They call you in if there's any changes. The nurse calls you, you get your counseling. And we also offer on-site syndromic management. So if the nurse is doing a pap smear and a lady has a little yeast infection or something, we give you the inserts for that. You take it home in your privacy of your home. You clear that up in 2-3 days, right?
Now, let me ask this. While the majority of the campaign seemed focused on women, is there any, how do I say, is there any move as well to be able to educate men, particularly with respect of the HPV aspect of it? Because cervical cancer is what affects the woman. HPV is the virus that the men carry.
Exactly.
What is being done in order to educate men about HPV and taking care of themselves in that regard? Well,
at the Cancer Society approach, we never take just the woman's approach. It's a whole of society approach. So when we educate the men and the women. As in some cultures, you can't get to the woman unless you educate the men. They're the leaders of the home. Their wife will not come out for that Pap Smear campaign until he tells you that it's okay.
Not Belize.
And for him to know that it's okay, you need to properly educate him and let him know what he is gaining by having this information and taking care of his family. Because at the end of the day, yes, the man is the head of the home. We can't only educate the woman because When you're married, if your wife has cervical cancer, the husband still has the support. And if the chances, if she's having cervical cancer, you have the HPV virus. So you both have to make sure that you're taking the necessary health checks and you're doing what you need to do. Because although it gives the woman cervical cancer in early stages, the HPV affects the men in late stages. Because if you have that virus in your genitalias for all these years, you continue that promiscuous sexual lifestyle, you're bound to end up with some horrible diseases. And this is what we want to push. We want to push healthy living. It's not just a one approach and say, oh, I do this so I don't have cancer. Because cancer is not one of the worst things as well. You have diabetes, you have HIV, you have all these STIs out there. The world is changing. So we have to be able to protect ourselves. And these young people are the future. When they get out there and they start talking and they do all this graphic stuff, it's amazing. You know, and I'm really happy to be a part of it. We're led by our president, Mrs. Laura Longsworth. Exceptional woman. She has a vision for the Cancer Society. And I can actually say for the past 10 years, we have been growing, we have been pushing. We're soon to embark on a childhood obesity campaign. We're working on a cancer registry. So we have a lot going on this year.
My final question to you, Rosario, is how receptive are youths like yourself when you go around or when you disseminate these information to them in respect of either cervical cancer or the need for them for women to get a pap smear?
Well, I think a misconception is that youth don't want to know, or they won't listen to you if you talk about it. But really, these facts are really interesting because when youth are thinking about their future, they're thinking about college and they're thinking about university and where they want to go. But they also think about their health. They want to be there. They want to have that longevity. A lot of times, youth maybe don't think that health, they have to worry about health because they're young and they're healthy. But if we educate, especially in terms of sexual education, I think they will be receptive in listening. I know I learned a lot, you know, even making these pamphlets and things that I didn't know. And I find them interesting to try to find these information, find these facts. And what I find interesting, I shorten and condense it and put it out there.
Interesting. All right. Is there any final words before we end this segment?
Our final words to the entire Belizean community, men, women, young ladies, adolescents. If you're at the age that you need a pap smear and you're sexually active, please come over to the Cancer Society. You don't even need to call before. You just make your way over there this Friday and Saturday, and somebody will be able to support you. So if you have any problems, you're having any type of discomfort, even if you don't need a pap smear, your breast needs to be checked, you're not feeling well, come on over to us on Friday and Saturday. We will be there to support you.
All right. Awesome. Ladies, thanks for stopping by this morning.
Thank you for having us.
A pleasure. We're going to take our final break, and when we return, it's to have a wrap-up. Stick around.